Hi, everyone. Welcome to tonight's Talk and Tour. I'm Krista Harmon. I'm one of the career readiness consultants with the Kent Intermediate School District, and I'm so glad to have Orthopaedic Associates of Michigan with us tonight as our Talk and Tour guests and role models from there. We have, I must have messed up my slides. Guess we're going to just have to keep going. Oh, the ones with your names on it, you guys. I don't know where that went. So to get us started, I'm going to have each of you introduce yourselves, your name, your title, and how long you've been with OAM. So let's do that to start. We're gonna start with you, Lisa. Welcome tonight.
Thanks so much, Krista. So I am Lisa Pearson. I'm the Chief Operating Officer at Orthopaedic Associates of Michigan, and I am the short timer of the bunch. I've just been with OAM since September 8th of last year.
That's great. We're so glad you're here, and we'll even dig into what Chief Operating Officer is, because I'm sure that's a new term for some of our young people. Sure. Hi, Casey. Welcome.
Hi, Krista. So I am Casey Zumer. I have been with Orthopaedic Associates since October of 2019, and I am the patient health coordinator.
Great. We look forward to digging into that too. We're so glad you're here tonight. Welcome, Chris.
Hi, thanks for having us. My name is Chris Postomis, and I am the OAM Director of Area Rehabilitation. So I look over physical therapy, occupational therapy, physical therapist by title in nature, and I've been with OAM since June of 2014.
Terrific. Thanks for making time tonight, Chris. And welcome, Katie.
Thank you. My name is Katie Ojo. Thanks for having us tonight. I have been a medical assistant here at Orthopaedic Associates since February of 2001.
Terrific. So you've got some time there.
I do.
That's great. And last but not least, I'd love to introduce Lisa. Introduce yourself, Lisa. And then I'm going to give Lisa a chance to kind of brag up about OAM for a few minutes before we get started.
Great. Thanks, Krista. Thanks for having us. I'm the HR Director at Orthopaedic Associates of Michigan, or OAM, as we refer to quite often. I've been here for about 4.5 years. So OAM, we are a large physician practice. We currently have 38 orthopedic physicians. Most are orthopedic surgeons, and we treat everything from neck to toe. So it is broken up into specialty. So we treat for foot and ankle, physical medicine and rehab, spine, sports medicine, hand and upper extremity, trauma, and total joint. And then we have our own ancillary services as well. So we try and have as many different services that a patient can need all within our organization. So we have our own physical therapy, occupational therapy, a work hardening center, OAM Now, which is our urgent orthopedic care, so you can get care on evenings and weekends. We have our own bone health program. We have our own wellness program for patients, which you'll hear more about this evening from Casey. And an outpatient surgery center, which we do a separate talk and tour on. So I think that recording is up, and hopefully we'll do another one in the future as well. So we have a ton of different career opportunities. We have over 80 different job codes or job titles within our organization. A lot of times we think about clinical roles when we think about healthcare, but there's a lot of non-clinical roles as well. So whatever your background is or your strong suit is, there's probably a career in healthcare for you. I was a first generation college student. I had no idea what I wanted to do and would have never imagined the depth of opportunities that we have within healthcare. So I'm excited for this event and hearing more about our own team members.
Thanks, Lisa. That's such a great introduction. And I know that's for some young people, you're already thinking, 80 jobs just within the one organization. That's so great to even just know that scope. So we're going to get started, Lisa, with you. When you were in high school, did you think you'd grow up to be a COO? Go ahead and tell us that journey, and even you can include what that is as part of your answer too.
Sure. So I'll start with that part. We'll go in reverse with your questions. So Chief Operating Officer, commonly referred to as COO, is a position that many different types of organizations have. So it's not unique to healthcare. It's not unique to OAM. You will find it in large corporations, in every industry. So basically, it is what it says. The operations of our organization kind of fall under my umbrella. So within our organization, we have a chief executive officer who's kind of the lead executive in the organization. And then we have the COO and the CFO. So CFO is chief financial officer. So he deals with the money side of things. I deal with the operation sides of things. And then we both report to our CEO. So everything from human resources to marketing to the actual clinical operations, everything that goes into patient care, patient experience, to our IT systems, really anything you can think of operationally kind of falls under that scope that I work very closely with our entire team. I originally, when I was in high school, wanted to be a pilot. So this was definitely not on my radar. I had grown up since I was 10 years old with an interest in becoming a pilot. I wanted to be a corporate pilot, actually, and went to college with that in mind, selected my college of choice. Auburn University is where I attended and graduated from, because they have a really strong professional flight aviation management program. So when I got into Auburn and spent my first year and a half in that program, did get my pilot's license. So I did fly. But eventually over that year and a half, I kind of decided, I think maybe this isn't quite what I want to do for the rest of my career for various reasons. So then I was like, now what? I didn't have a backup plan. So I really sat down literally with the course catalog from Auburn and started rifling through that, reading about every different major that they had, really did some internal, perspective of thinking through what are the things that I kind of gravitate towards. I had grown up with a father who was director of human resources with General Motors, and always loved going to work with him on Saturdays and playing with the office supplies and things like that, which sounds really funny to think you're making a career choice out of that, but just definitely gravitated more towards, I think, the business mind, the business brain. But then I thought, okay, business, that's a pretty broad category. I'd also always had a real interest in healthcare. So I literally remember sitting on my apartment sofa at college and thinking, I wonder if there's something that could put those two things together, having no idea that there was such a thing as healthcare administration. So went and spent time talking to the dean of that department and ended up deciding, yep, this is for me. Transferred to that program, got my bachelor's in healthcare administration, and then moved on and got my master's in healthcare administration, as well as my master's in business administration. And here we are today.
That's fantastic. And just two things I want to pull out of there too. I love that you talked about how you can have two interests and then they can come together. So
Yep.
Young people definitely take note of that. And I also remember really digging into the course catalog. In the old days, it was actually a paper booklet.
Yep, it was.
But
Yes.
young people, that's such a great strategy when you want to know what's out there, is to take the opportunity to go to one of your colleges that you're interested in and look through that course catalog. It could be a really helpful self-assessment. So thank you for that, Lisa. We'll definitely come back and dig into your job more. Casey, we're so glad you're here. Patient care coordinator. Did you even know what that was when you were 16? Tell us what you were thinking.
No, not at all. So when I actually came to OAM, my job, it was my first day, it was, what do you want to be called? So I had a couple of days to kind of figure it out. But when I was 16, I actually wanted to be an athletic trainer. And that is actually my degree. My career field is in athletic training. I knew actually when I was in middle school that I wanted to be an athletic trainer. I graduated from Union High School, go Red Hawks in Grand Rapids. So I worked with our athletic trainer when I was in high school, transitioned, did my associate's degree at Grand Rapids Community College, worked in the athletic training room there, then went out and finished up my my bachelor's degree in Vermont and got my degree in athletic training, came back to the West Michigan area, did my master's in exercise and sports medicine. And that's kind of how I found my love and my passion of athletics and sports. My first career was actually, or my first job was as an athletic trainer for a school system in Maryland. But then the school system, I actually did a joint position where I was working in an orthopedic practice, in a small orthopedic practice, and then also working in the school system too. So I kind of got the best of both worlds, working with different orthopedic physicians and things like that. I also worked out at the Mayo Clinic in Minnesota in their sports medicine department. And during my time, both in both orthopedic practices, I kind of found my love for nutrition and came back to Grand Rapids. And this job was actually for a wellness coordinator position. So what I actually do now is I run our weight loss program. Which is something that with my love of nutrition and educating patients and counseling them in the office setting really gave me my passion for what I am doing now.
And I love it. I love that first you knew so early. Was there an experience that how did you even know that at that young age what athletic training was?
So actually it was, my dad, is in education. He started out as a teacher and football coach, and, sports was always a big part of our lives. And I really, really enjoyed medicine. And, I remember very vividly, it wasn't during a game or anything, but I sprained my ankle for the first time. And, my dad actually brought me into the athletic training room at Grand Rapids Community College, and Mike, the head athletic trainer there, was able to take care of me and just kind of fell in love with the career. And he was actually one of my biggest mentors growing up. So
yeah, I've heard that from young people, and I want to encourage young people, like, these life experiences that you're having can be clues into what you might want to do someday. So don't underestimate those little touch points when you meet someone that you really admire, or you hear about something that's really intriguing. Like, take that clue and research it more. And I love that you ended up at an orthopedic organization, Casey. That's so great. So Chris, you are a physical therapist. You're a director now and oversee a bunch more. But what were you thinking back in high school? Is this where you thought you'd end up?
This is not where I thought I would end up. Actually, in high school, I have to say big props to all of you for being here, because you're already ahead of where I was at that time. At 16, 17, my life in high school was pretty much sports. It was one season to the next, travel basketball, and I'd travel water polo. I'd spend summers in California, Texas, kind of playing. So it wasn't until later that I even started to think about a job career. I'm the youngest of 4 boys by 6 and 8 years. So by the time I was at this point, my oldest brother had got a great job out in California with computer security systems. And then my other brother was just about to graduate with a teaching degree. So both of those had some interest in the back of my mind by the time I got to college. I've always enjoyed the math and sciences. I was always in advanced math, advanced science, didn't know how to pursue that or where to go with them. So I took a lot of different routes when I first got into college. Again, played 2 college sports, so was intermixing, kind of, declaring a major, which declared a few through my college career. Started out with computer science, thinking I'd follow that route as my oldest brother. He had a great job. I'd love to go visit him in Santa Barbara. And I took my first programming class in Java and decided that that was not the fit for me. So I kind of went back to undecided and moved back into the realm of science and math, and kind of moved forward in that route, and eventually settled on health sciences, which was a great combination of chemistry, biology, physics moving forward. And through that, I had all the odd jobs, landscaping when I could here and there, working for a printing company. And when I came out with my bachelor's degree, I was still undecided on a career at that point. My first actual, I guess you would say, degree job was in quality assurance. And I did a lot of raw testing of materials, making sure that for everything that was getting put together, everything fit and was in the right order. I did that for my first year out of college, and I moved from there to get my personal training certificate through the National Academy of Sports and Medicine. So I started working at the gym, doing that, lifeguarding and coaching water polo on top of all of that. And that's really what started to stir my interest to say, okay, how can I take this? Because when you're in the gym, your schedule's all over. And how can I tighten this down and what makes sense? And that's when it led to, okay, do I want to pursue physician assistance or physical therapy? And after I broke it down and being in the gym and having the personal training degree, just the ability to motivate people, kind of modify how they live, they move, that's what settled me into PT. Applied and got in a few years after my bachelor's and kind of went that route. And I started off out in Chicago after I got my doctorate in physical therapy and passed the national board exam. Worked there for a few years and got some minor managerial experience over a few clinics there before coming back to OEM in 2014. Came back as a staff therapist here and just have been fortunate to kind of move up and get the offers back into kind of a little bit more of an administrative position.
Well, great, thank you. And I love that you were even deciding between that physician's assistant and physical therapist, because I know a lot of young people like they want to know, like, how do you even decide? And I love that you picked up that piece of motivating people, you know, really specifically that there was that coaching side of it that was a little different with the PT. And that was one of the characteristics that helped you decide. That's, again, kind of looking at yourself and your interests. Yeah, that's great. That's helpful for young people to hear. Thanks for sharing. Katie, we're so glad you're here. A spine medical assistant specifically, but tell us, back in high school, did you think you'd be an MA?
Well, interesting. I am actually one of 6 children. And when I was actually asked in 12th grade what I wanted to be, I was really put on the spot. And I chose nursing just for lack of a better option, not knowing what I was quote unquote getting into.
Yeah. So then what happened once you realized, oh my gosh, I have to really be a nurse? I'm not sure I like this, or what happened?
So essentially I had a sister who was at a traditional 4-year college, and my older brother was in the Navy, and I was the 3rd child now to make this decision. And I had decided actually before I wrote this paper that probably a traditional 4-year college was not for me at the time. I really kind of struggled with some of the academics and staying focused and holding myself responsible for some of the timelines associated with that type of regimen. So I came to Grand Rapids and I joined a trade school here and became a medical assistant. It was about a 12-month program from September to September. So it was intense while I was in it. I did actually, after I became a medical assistant, kind of have dreams and aspirations of being a nurse at some point in my career, but I fell into OAM's lap, and I've loved my job ever since, and I've stayed here for the last 20 plus years.
And I think it's so important for you to be sharing, because for so many young people, either one, they know that they don't want to do 4-year, or they're concerned about college expenses. And there's so many amazing jobs in healthcare that are certifications or 2-year programs where you can make really good money. So I just love that we have that diversity in our panel tonight, so that young people know that there's something for them wherever they are on that spectrum of education. And, you know, going on to become a doctorate, like in physical therapy, not everyone can push through that kind of schooling, right? That's kind of a gift as far as I'm concerned. So again, certifications, 2-year advanced. So thank you so much, everyone, for sharing that kind of path with us. As we move along, Lisa, back to you. Just give us, for each of you, I want you to give just kind of a synopsis. I know there's not a typical day, but I do hope that young people learn about some different jobs they didn't know about, but they could do some additional research. But just a typical day of what a COO is. And then we'll go on to Casey when you're done.
Well, my answer to that would be that there isn't a typical day, as you said. You know, I can frequently have, you know, lots of collaboration. So lots of meetings. Nowadays, it's lots of virtual meetings, go-to meetings, you know, so I can have up to 10 a day, to be quite honest, varying on all topics. I could be, you know, meeting with other directors that report to me, you know, collaborating. It's all about collaboration. I mean, that's really what it's about. So, you know, I really see my role as supporting the folks that are really doing the work, to be quite honest. The directors, you know, people like Casey and Lisa and Katie and Chris, you know, so that they can do the best job they can do to take care of our patients and to remove the barriers that stand in their way of doing that. So, you know, I can have a meeting with Lisa talking about different employee, you know, recognition initiatives that we have going on, or doing a market analysis for employee compensation and reviewing that with her. And then 30 minutes later, I can be meeting with our director of registration about a specific process issue and helping brainstorm solutions to that process. And then 30 minutes after that, I could be meeting with our CEO and our CFO talking about new strategic initiatives that we have going on out in the community where we want to, you know, maybe partner, align with other organizations. And then in the midst of that, we could have some kind of, you know, patient issue or HR issue come up that kind of blows the schedule out of the water. You know, and frankly, that's one of the things I like about my job probably the most, is that unpredictability of it, but also the variety of it as well.
Yeah, and I love that there's some young people tonight who are on the call that, you know, think they want to go clinical. And I think it was even at OAM, you know, there was someone who was planning on being a nurse and ended up changing because of one of the classes she just couldn't get through, and loves electronic health records. So I love that you're sharing what you're doing so you can still be part of the healthcare system and helping
Absolutely.
patients in a really non-clinical way. So thank you. So Casey, give us a snapshot of what a typical day is like for you.
Yeah, so a typical day for me, I normally see patients in usually half hour increments, depending upon if I'm seeing a new patient or an old patient or an existing patient, sorry. But talking with them, collaborating with them, how their weight loss journey is going, and that is really what I do with patients on a daily basis. But then I actually kind of get the best of both worlds, or all worlds, because I actually do the program that I run is a food-based program. So I do inventory. So I do a lot of administrative work too, just keeping up with an inventory count. I will, you know, pack up all of my own food bags for patients that are coming in. So that's all kind of the administrative side. So it's just, I kind of like Lisa have a lot of different moving parts going on because I'm clinical. I'm talking on the phone with patients or trying to get patients to join the program. I can collaborate with physicians on a patient that is having a successful time within their weight loss journey, or having issues within their weight loss journey that we need to address. So I honestly have the best of both worlds, being clinical and administrative.
And I love to hear, you know, obviously you love your job, and that's so great to hear people who found that niche that they could be so thrilled. That's great. So Chris, I know there's many students who physical therapy is a very high interest for a lot of young people. One, because they don't know a lot of the other options, but definitely I know students are on this for you. Tell us what a physical therapist, what a typical day for you is. I know there's probably not a typical day, but what do you do each day?
And I'll kind of speak more to kind of being just a staff therapist, where you're going to see patients every day. It's probably more interest than kind of the admin.
Yeah, at this age, yes.
So generally, physical therapy, it's going to be around. It's a gold standard of healthcare, and there's so many regions you can go into as far as skilled nursing, neuro. Obviously, here we're orthopedic outpatient. A lot of post-surgical, given our situation with the surgeons. Which is great because we have the communication, we have the notes and the documentation. So really, when you come in to your day, generally an 8-hour day, you would expect to see 11 to 13 people filled up on your schedule. Very normal. And just to prep for that day, you're going to look at your initial evaluations first, kind of roll through, okay, why is this person coming to see me? Try and get some background, some medical history. Try and piece together what you can about that patient before they even step foot and you say hello to them. Try and gather, what are my thoughts? How do I think this might go when we get to talking for the first time? And then reviewing the patients that have been coming to see you just to make sure, okay, Chris has been here 4 times already, realize, we got to really up his program. He's doing pretty well. I've seen that he's told me he's doing better each time he comes in, and just making sure you're advancing appropriately, making sure you have a timeline to get that person better, to kind of get them to where they want to be, meet their goals, because we don't want people to see us forever. We do have favorites, but everybody, we want to get back out the door at some point. So I think kind of a normal day with that, and then there's always kind of the backside. I think a lot of people don't realize there is a lot of documentation and behind the scenes involved that takes up some time. So again, kind of piecing your day together. Okay, if Lisa's in now and Chris is in next, can I squeeze 10 minutes? Is that a good time to sneak away and do a little bit of paperwork? So really it's that, but it's a ton of fun. Physical therapy is a laid back atmosphere. Usually multiple people in the clinic, patients can get into it. You're not worried about, talking out loud and having people overhear. It's a fun environment, especially in a setting such as this.
Yeah, do you see your patients kind of in that, what seems like an athletic environment, kind of a weight room kind of place, or are they more in offices? Because I took a tour one time when you say it's kind of a casual environment.
We are much more in a big gym style casual environment. We do have some back rooms because that is appropriate for some patients that come in to see us. But otherwise, in OEM in general, we just kind of updated beautiful gym at this point with some new construction. So we love having everybody in the big environment out, everything kind of out in the open so people can see other people working out. And I think that just helps relax everybody in the atmosphere.
Yeah, and just to remind the young people, like a lot of these positions, they can be done in different settings. Physical therapists can be at schools, they can be at hospitals, they can be in these. So again, it's just an umbrella. So as you do your research, but I love that casual kind of athletic environment. That's fun. Katie, when you think about being an MA, I know that that's a very busy type of situation too. Tell us what some of your tasks are, what a typical day is like for you.
Oh, sure. So a typical day for me typically entails more days than not, I'm in the clinic running patients. It means gathering their health histories, going over medications, their family history, their social history. We also do in orthopedics a lot of test scheduling. So we order a lot of MRIs and CT scans. We always want to ensure that the patients have the proper follow-up care after those. So you follow up and make sure they have scheduled appointments with the physician. On my end too, I also see post-ops. I do, today I was pulled and asked to do a blood draw in a different department. The job kind of, fluctuates day to day. I do a lot of patient phone calls, patients who have questions about maybe an incision, or they have questions about medications. They need medication refills. They have questions about the physical therapy that they're doing or shouldn't be doing. And then the day, of course, starts with a large cup of coffee. And essentially, as a medical assistant, I always tell my young students, because I also love training, I always tell them that a medical assistant, you can really, when you get into a job that you absolutely love, you can truly make it what you want to make it. You can, if you really love the clinical side of things or the clerical side of things. I'm mainly a clinical MA though here at OAM. That's how I function.
Thank you. And I love that you get to do training as part of your job too, because again, we have multiple interests, it's that part of your job, but also teaching people and training. I love that. One question that usually comes up from young people in these type of situations is, what do you love most about your job and what causes stress or that you don't like? Lisa?
I think what I love most is probably the collaboration, which I referenced earlier. The working together with lots of different people to meet mutual goals, you know, and to kind of help motivate people and coach them. That's something that I really enjoy as well. I really enjoy working with our physicians too, just collaborating and building that trust, and having them, you know, rely on me as a key member of that team, you know, just getting to work closely with so many different people. What do I like least? I mean, certainly as far as what causes stress, you know, anytime in any organization, you have a lot of competing priorities. That's going to cause stress, but that's no matter where you're at in whatever profession you're in. So, you know, that I think also builds resilience, and it builds some really great skills for, you know, for dealing with that. Just like, you know, these students are probably, a lot of them, nearing exams, you know, it's the same kind of thing, just in a different way. So I would say that's probably the things I like the most, and then the things that cause stress.
Thank you for sharing. Casey, what about you?
So actually, kind of like Lisa, one of my favorite things to do on a daily basis is coaching my patients. So you know, teaching them about nutrition, teaching them about weight loss, doing, you know, exercise and things like that. It's hard in an orthopedic practice because a lot of the patients that I do see are patients that need to have surgery. So it's hard for some of them to be able to exercise while they're trying to have a surgical procedure done and trying to lose weight at the same time. So, but, you know, just being able to help patients achieve their weight loss goals is one of my favorite things. That's what drives me to come into work every day. On the flip side of that, one of the things that is stressful and is very difficult for me, I'm a very nice person, so I hate to be the bad guy. So when my patients don't do what they're supposed to do and they come in, it can be very stressful, but also it's very disheartening to me to have a patient that comes in and is like, you know, I did the wrong thing and I, you know, slipped up, and it's heartbreaking to be in that situation. But you know, I make it through with them, and it's every day is a new day, and that's really one of the things that I coach them through.
It sounds like you just want the best for your patients, right? And that's why it's so hard. Yeah.
Exactly.
Thank you for sharing. Chris, what about you? What do you love, and maybe what you don't like so much?
I would definitely say that, I mean, in this job, again, it's a fun atmosphere. You're on your feet, you're moving, open conversation, your teammates are all with you, all the other therapists, our aides. It's a very open setting. And again, being in an outpatient physical therapy setting, it's different. It wouldn't quite be that way in other settings. But here, I would say that's one thing that drew me to it and why I love it so much. When patients come in, not just your patients, but the other patients that your coworkers have, you actually get to see them improve, especially coming after a surgical procedure. They're coming in and you get to know the other therapist's patients sometimes as well as your own. And you see that person come in, not even be able to walk. They had an ankle surgery. And all of a sudden you're following your own patient and realizing that you're the one that's helping push and move that. You're answering their questions. You're telling them, okay, yeah, we're getting in a shoe today. And just to kind of see either the terror or the light up on their face when you let them know that. It can go both ways. But I think that is one of the greatest things about PT is you are actually setting goals and just watching them kind of happen for that person. Stressful at times. There's always that person that just doesn't seem to be improving. And that's stressful because you question, well, am I not doing the right thing? It's stressful because then you might have to go back to the physician and say, you know, hey, we've been trying XYZ, we're not making any progress. So that is probably the added stress day to day. Outside of that, again, if you truly just forget your documentation. That can be stressful at the end of the day when you sit down and you're like, ooh, I had a great day. I saw 13 people and I have a lot of notes to write. So time management, as long as you're up to date on that, I don't think you can beat watching people improve, and generally just be happy with progress getting through in therapy.
Yeah, I hear kind of a cheerleader theme a little bit, like coaching people, rooting them on, helping them move along a continuum. That sounds.
Yeah, there are those patients that need a little bit more stern heart to heart, like, all right, we're going to do it or we're not. But for the most part, the vast majority are willing to be on board and make it a fun experience.
Great, thank you for sharing. Katie, what do you like? I know you love your job.
I truly do love my job. So one of the things I do like best about my job is coming into work and seeing my coworkers. It truly is a joy. But I love people. I love having that patient contact, talking to them on the phone since COVID. Previous to that, we'd see them face to face. But I have that connection with people where I can talk to them about something so simple that I feel like I just know them so much better just by bringing them to an exam room. I love, being able to work in a field where we're essentially helping people. We're helping them be the best they can be, whether it's through surgery, physical therapy, weight loss goals, that people come to us because they're looking to be the best that they can be. And that's really our philosophy here at OAM. But I truly love nearly every aspect of my job. In fact, I've been sitting here thinking, what causes me stress? And I'm kind of twiddling my thumbs because I'm thinking, I don't really know, but if I had to choose something that causes me stress at my job. So here in spine, our doctors take what is called trauma call at the hospital. And when they're on trauma call, sometimes we have to do rescheduling, and rescheduling in the world of healthcare can be one of the most disappointing things you have to do for a patient. So I would say that's probably one of the things that causes me more stress if I had to pick one thing.
I was just talking to my daughter today who had to do a bunch of rescheduling in a healthcare environment. She was just lamenting that, just literally on the phone today, that was an awful day.
It's tricky. It's really tricky. And some days it's better than others, but yes.
Well, it's probably fun for you, Lisa, to hear, some of your staff enjoying their job so much. Teamwork is something that obviously seems really important. Young people are taught a lot about soft skills at school, and teamwork being one of them. I'd like each of you to share, and we'll start with Lisa, maybe one of the soft skills, but really more when you think about your role, what are some characteristics about a person's personality or interest that would make them good at the job that you do? That's kind of what because I want the kids to start self-assessing of their own interests and natural talents. So Lisa, what would you like to say as far as characteristics that make someone a good COO?
Yeah, I think being curious and being an eternal learner kind of goes hand in hand with that. And maybe it's a little more acute for me even because I've only been at OAM since September. So, there's still a whole lot that I'm learning, certainly. But I think, really looking at each individual team member that you work with, because I don't have as much patient interaction. My primary interactions are with our team members and our other members of leadership. And I think, trying to be very objective and fair-minded and curious, that would be the biggest thing, because process improvement is a huge part of my job, digging into operational processes or initiatives that we want to develop. And so, I'm constantly learning from the people that I work with, and we're constantly asking questions and trying to look at things from all angles. So I would say curiosity is probably a really big one.
Yeah, and I think just even you spell that out, some young people might not consider themselves curious until they heard how you just described it, and they're like, yeah, I'm kind of that way, right? That's great. Thanks, Lisa. How about you, Casey?
One of the biggest things that I feel is important, especially in my role now, is being empathetic. So being able to be a good listener and really understand what my patients are saying, and how, especially I have a lot of patients who have tried to undergo weight loss before and have had problems, and just being able to empathize with them and understand really what they're going through. And it's really helpful for patients to understand that that they have a cheerleader in their corner the entire way. So, even though it can be stressful when patients come in and say, hey, I didn't do exactly what I was supposed to do this week, but still understanding, where they're coming from, meeting each patient where they're at every day, and just being able to understand and walk in their shoes and be able to get them through.
Absolutely. And some young people discover in their path, oh, I really don't like people that much. That's okay, right? We just have to get to the job that fits us. So I love that you explained it that way. How about you, Chris? As far as some natural talents and traits or interests that make good PTs.
Yeah, I'm going to piggyback a little bit on Casey there for some of this too, but just being conversational and personable can get you a long way in physical therapy. We do spend a lot of time with our patients. They come in and you're going to have at least a half hour, if not an hour. So to be able to keep that conversation going, keep it light, make sure that they're not beating themselves up, and keeping everything lighthearted. And to go with Casey, being empathetic and listening is extremely important. You'll find in PT over and over again, I just came from Dr. X. He gave me 5 minutes. I came from Dr. Z. I don't think he listened to anything I said. And then you get to then explain in more layman's terms, kind of bring it down and have that full conversation and become, kind of more personable with that patient. So if getting in front of people and not being able to have that conversation or being too reserved, not to saying you can't do it, but it may make things a little bit more uncomfortable for you. And then just overall interest, obviously sports backgrounds. You don't have to be good at it, but if you're interested, by all means, this can still be for you. If you have the interest in how the body works, physical movement, restoring, kinesiology, biomechanics, it's all available. But if you don't have an interest in that, I wouldn't pitch that this would be, if it's not in your blood to sit down or care why somebody is wobbling or hobbling when they walk, it's probably not something that you're going to want to do every day when you come into work. And finally, just kind of having that detailed personality. I would say that a lot of therapists probably lean more to that type A scale, which is good because you do walk into a full schedule almost every day. So having that detail to know, okay, I'm going to get through my patients today. I've got 4 evaluations and the documentation needs to get done. It's a huge help. Again, it's not mandatory. That's not the way I lean. So that was harder on me getting into this profession a little bit. But it's another point that I think is will make therapy more interesting in the aspect of everything.
Thank you, Chris. That's great. And Katie, what makes a person a good MA? What traits are we looking for?
I'm going with the trend here of empathy, but I'm going to add to that a little bit too. So on my side of things, we see patients typically when they're in a lot of pain preoperatively. So we have to be empathetic towards how they're feeling. We have to give them hope for the future so that they can see that after surgery or therapy, things will get better. So we have to give them hope. And I also think being eager to learn your job and your role, being eager to learn new things, and truly being caring, kind, compassionate, all those things that we kind of learned in kindergarten really make you a good clinical person. Knowing when you have to just give someone perhaps a little bit extra time, a few extra words of encouragement. And some people, they might not need that as much.
Thank you. That's so great. I'm inspired for sure already. I know that I want to get in we only have about 13 minutes left, a little more than nuts and bolts. Students like to know, for example, what kind of education do I need to get into this, or what kind of degree do I need to get in? And so Chris, when you think about physical therapy these days, how do young people understand that? Do they have to have a certain bachelor's degree, or is there a little flexibility in what that first step out of high school can be to become a physical therapist? What are and what would you maybe suggest that they consider?
There is a little bit of flexibility, so you will need a bachelor's degree to get into physical therapy school. So your 4-year bachelor's and then moving into a 3-year clinical doctorate program. But that bachelor's degree does have some leeway, but there are some specific prerequisites. So you will have to kind of find out from a local PT school. They're pretty straightforward across the board, but there are going to be some core classes that need to be taken, certain levels of chemistry and physics, anatomy and physiology that have to be completed. So your best bachelor degree options are usually a kinesiology, exercise science, athletic training, something that is going to kind of push the realm of incorporating all of those together to get in, because generally each PT school is going to have a classification of those classes and kind of how you did in those in your application process.
That's helpful, that young people don't have to do a certain thing. And I just want them to hear that. Katie, I'm just kind of going backwards, I'm sorry. Medical assistant, is that a 2-year training as far as your understanding? How do young people get into that?
Yeah, so medical assisting is kind of broad. Davenport's is a 2-year, it is an associate's degree. I went through a program where I was trained more like a trade type of school. So we went from September to September. There are some local schools like Ross, I believe, and they are on it's a 6 or 8 month program. So there is definitely a lot of options for medical assistants to get enrolled in school and kind of make that your stepping stone for your healthcare career.
I do want to plug West Michigan Works actually has an apprentice program too, where you can learn on the job while you're also getting trained, and they pay you while you're training. So any young people that, again, if the paying for training is an issue, Google West Michigan Works, they have an MA program, and you can, goes right into a job because you're learning on the job. Thank you for that. Casey, I know you had your undergrad in athletic training. It sounds like that opened a variety of doors for you. If someone wanted to get into the work that you're doing today, is that the route they should go, or what would you suggest?
It's actually pretty interesting. So, yes, my degree is actually in athletic training, and I do have a bachelor's and a master's. Now, athletic training is an entry-level master's program. So you're going to be devoting 5 to 6 years to get through and come out with a degree in athletic training. I did some extra certification work to actually start the program that I am running now. Plus I am doing multiple other nutrition certifications as well, kind of going forward, just to broaden my scope of practice here. And one of the certifications that I'm going through is through the National Academy of Sports Medicine. I also have a strength and conditioning certification too. So those are just move at your own pace certifications that you can pick up. It does help to have a background in anatomy and physiology, and a little bit of background in nutrition and things like that to get to go through those certification programs as well.
And I think you bring up such a great point that oftentimes it can be certain education, but the certifications are where you really start to dig in and specialize. So sometimes it doesn't have to be that advanced degree to do certain things. It's a certification. So again, young people really, find out what those requirements are before you invest in a bunch of education, because you may not need it for what you want to do. So I love that you got to share that. And then Lisa, you got your degrees in healthcare administration. Is there anything that you would recommend to young people, and this will go back up the chain for all of you, that they could be doing in high school to kind of prepare themselves for working on the administrative side? Any volunteer work that any other internships, anything that you'd like to suggest for them?
Yeah, I would say any kind of volunteer work, if healthcare administration is your interest,
You know, the vast majority of folks in healthcare administration that I've met through my career really relish and enjoy the opportunity to connect with young people. I've had several interns through my career. You know, networking is so hugely important at every stage, you know, and you're never too young to start that. So even if it's a cold call to somebody like me, you know, I have an interest in this, can I come sit down with you or have a phone call with you? Don't be shy about doing those types of things, would be a huge piece of advice that I would give. You know, and the other thing that I'll just mention is, you know, even though I'm in a physician practice with my background in healthcare administration, that field is very, very broad. So just like, you know, many of the fields we just talked about, you know, whether it's MA or PT or nursing or, you know, athletic training, you know, healthcare administrators with the type of background that I have, you know, they're in hospital administration at every level. They're in long-term care administration at every level. They're working in insurance companies at every level. You know, they're working in surgery center management, practice management. You know, there's just a tremendous variety of opportunities within that very broad category of healthcare administration.
Yeah, and that's why young people, these kind of events are so important because you're going to learn about more and more options. But so many of that first step is an umbrella, and it's training you with a certain number of skills and experiences, but there's going to be a lot of variety that you can do. And thank you for all those beautiful examples. Sticking with kind of maybe what to do in high school or some internships, volunteers, anything, Casey, that you did? Obviously, you did some information interviews and job shadowing. Anything that you'd like to really help the young people understand the importance of some of the early exploration?
Especially in traditional athletic training, early exploration is a big thing. Athletic training is not all fun and games. I mean, it definitely is, but there's more work to be done than just being on the sidelines at a football game or at a basketball game or at a hockey game. It's a lot of long nights and early mornings, and you know, it's fun while you're in the middle of it, but it can take its toll as well. So just, you know, knowing what you're getting into before you're doing what you actually want to do. One of the reasons why I got out of traditional athletic training was because I wanted more of an 8 to 5 Monday through Friday career. So that was one of the reasons why I started looking more into working in a physician practice.
Yeah, I think having those realities up front is so important. Due to time, I'm gonna just ask Chris, do you guys do any job shadows for students that might be interested? What are some things that students could do in high school if they're interested in PT?
We do. Obviously, COVID has changed some of the rules on that across the board, but generally, yes, any physical therapy practice, including us, you know, if you find the right channels, contact. Job shadows are great. And again, my interest into physical therapy was later, so my job shadows did not start until later either. But I would definitely recommend, and even PT schools across the board are making you get 50 to 100 hours across different disciplines to go to outpatient, to go to the inpatient, to go to the skilled neuro facility, see neurological patients. And they want you to be sure that this is something you want to do, because it is a 3-year commitment, and it's a fairly expensive high-level degree. So the more shadow you can get to see if you're interested, because then you see the whole picture. You get to hang out with the therapist in the gym, see the patients, you get to see them sit down at their computer and what work they do on the back end. So yes, always making that phone call and say, hey, do you have the availability for me to come in just to hang out for 2 hours for 3 or 4 weeks? Any little bit, I think, can help spark interest on if this is something you'd like to be doing.
That's awesome. And I'm really glad you brought up the hours requirement, because it's so important for young people to know what those expectations will be, so you can kind of back it out. So you can be doing some things in high school that's going to get you ready, versus all of a sudden finding out, oh my gosh, I have to have 100 hours of contact hours and I haven't even started. So thank you for bringing that up. Katie, do you ever do job shadows or get students in behind the scenes?
We do externships. But I'm sure if someone was interested in medical assisting, they could probably arrange a few hour time shadow opportunity here. But we do MA externships, and those require all externs who are trained to require between 160 and 180 hours. So yeah, definitely if you're interested, find the right channel here and at OAM, and I'm sure we could help facilitate that.
That's great. So Lisa, I'm going to have you queue up your video here. I did want to just give a plug for the Tech Center. The Kent Career Technical Center is a way you could get some training free while you're in high school, and they do have a rehabilitation class. They have kind of a health career explorers. They now have an EMT. So if you're not familiar with the Tech Center, young people, I want to put that, copy and paste that into your browser and check out some things you could be doing in high school as well. All right. We're going to show you a little behind the scenes of the Leffingwell location, everyone. I know we couldn't do an in-person tour, but this will give you a little sneak peek.
Trying to get it open, sorry.
That's okay. I should have gave you a little more warning.
No, it's okay. It was,
And the role models can be thinking about just a final word of wisdom. We will come back to you. So anything just as a last encouragement to these young people who are, like you said, really impressed that they're here, you know, exploring already. But I'll have you do that after the video. Unless Lisa wants us to do that now. It depends how much time she needs.
if you want to do that now, that's fine. I just had it open before and tested it, but.
Well, like I said, I lost my whole slide. They had your names on it. I'm not even sure what happened there. So Lisa, give us a word of wisdom, and then if the video starts, we'll obviously flip back to that.
I'll just go back to what I said earlier about networking. You know, you're never too young to start networking. You know, it could be, you know, friends of your parents, or, you know, teachers that have connections, or like I said, just, you know, if you have an interest in a certain profession, even if you don't necessarily know if you have an interest, you know, don't be afraid to just cold call somebody and say, hey, can I set up a phone call with you? Can I set up a virtual meeting with you? I will tell you that is something that's really important to do through your entire career, is to continue to network, never turn down an opportunity to meet new people. My last 2 jobs, OAM included, were not jobs that, you know, there was a posting out there. I knew people and ended up in those roles because of that network.
Yeah, I think the statistic is 65% of people get jobs through someone they know. So definitely a good skill for sure. How about you, Casey? Any word of wisdom?
My biggest word of wisdom is just be open to possibilities. I never thought that I would be in the realm of weight loss like I am now. But it's fun being able to use my athletic training skills and the knowledge of nutrition in a different way to be able to help patients. So just being open to different possibilities is the biggest thing.
If they can have that one takeaway, I love that for sure. How about you, Chris?
I would continue on the same guidelines, the experience, the shadow. Make sure you get out and know the real anticipation of what you're looking for, because that's what's going to open the biggest door. Something could be fun in the classroom and on paper, but then when you actually get out there and see it, it can change a little bit, and you don't necessarily want that to happen. And the more people you meet, if you all went home and asked mom or dad, hey, do you know a physical therapist or an occupational therapist? They'd probably be like, oh yeah, your aunt had PT here. We could probably call that place and get in. And just knowing that even if physical therapy itself, when you shadow it, isn't something you're necessarily interested in, it can lead to other positions as well. I've had students that came and shadowed, and I just thought about this when I was kind of muted again, is now they're actually PT aides for me that help us run the gym and keep the gym organized, help, you know, run some exercise with some patients. So there's always something else that can stir that, okay, PT didn't work out. I really don't want to hit that level of education. The 3 years doesn't sound fun to me, but I get to be in the gym experiencing it, and it's still a paid position. So just the experience, and definitely the piggyback on the networking. You never know what can open from just having simple conversations.
Absolutely. Physical therapy assistant, young people, 2-year degree, Baker College in Muskegon. Check it out if you have not heard of that. Katie, word of wisdom.
So my word of wisdom, I have college age students. So my words of wisdom are keep being the best version of yourself. Be true to yourselves. Give yourself a pat on the back for a job well done. Don't beat yourself up if you struggle in a class. Keep your heads high and try and make all your dreams a reality.
That's gold right there. Thank you so much. All right, Lisa, your turn. Thank you for having this put together too.
It is not opening. I'm getting a server error and I'm
Okay.
not sure
Okay.
what that means.
That's okay.
So I apologize.
You know, that's the Zoom world. That's what we have to live. Now I did, let's see if I can pull my slides back up. I did have just a quick view of your website. So I want to encourage people to go to your website and, you know, tool around there a little bit. Let's see for mine, see if I lost everything here. So oammichigan.com. Again, you can go there, and I'm not sure how many pictures you have on, but might give them a little sneak peek by some of the photos. And they can dig in. I even saw the careers page at the top. You see a link for careers. They have many postings, you guys. And again, I want to recommend getting in there, reading some of those, because it talks about the qualifications. It's going to give you clues and the kind of things you need to do to get to some of those jobs. So it's a great way to kind of start preparing for what your future is. And I wanted to point out onetonline.org. Great research. You can put physical therapist in it. You can put medical assistant in it. You can put healthcare administration, and it'll give you all sorts of great information. When I put physical therapist in, all these jobs that are very similar to it popped up. So what a great career tool to research. And when you click on it, it will give you what the typical pay is like, what the typical day is like, what kind of education you need, and it will really help you explore. So I just wanted to point that out today too. So big thanks to all of you role models for being here tonight. Students, showed them some love in the chat. We really appreciate your time on a night that I'm sure you had a busy day. I know it's very valuable to the students. So thank you so much for being here today.
Our pleasure.